Hi, I'm Tom Lynch, Two Things. Today I'm delighted to be joined by David Ting. David Ting is our Chief Medical Information Officer of the MGPO and somebody who cares deeply about how we can make the practice of medicine better, both for our patients and for our providers. David, I'm incredibly excited about what you've told me about virtual scribes. Tell me about the program.
Yes, Tom. So, as we all know, our physicians by and large learn to document on handwritten notes, typed out, and so on. But clearly, with all the changes in regulations and the EHR with meaningful use and so on, the burden of documentation has just skyrocketed. What virtual scribes do is they take the burden of documentation away from the doctors and allow us to document simply by talking with the patient, and a recording device records that interaction, sends it out of our environment, and the document is typed up in the background.
Who does the typing?
So right now we're leveraging a vendor, which is the same vendor that we used for our medication transfer work from LMR into Epic. That's right.
Okay.
And it turns out that this vendor has a number of physicians that work offshore, and they can listen in on our exams and type it all out and produce beautiful documentation for us.
Now, the clinician actually still has to review the note, correct?
That's right. That's right. So because of compliance rules and so on and privacy, our physicians are the only ones who can see the drafts before our physicians sign off on it and it becomes part of the Epic record.
Now, are you using this in your practice?
I am. So actually for about the past 4 months or so, I've been using a virtual scribe. Not only does the scribe do the documentation for me, but also tees up the billing and the coding.
And do you do it for every patient you see or just some?
Every single patient.
Every single patient.
And Tom, it is amazing the freedom it gives you to be able to see your patient, focus on the patient, and when you're done with that visit, you really are done. And then you walk to the next room and you just start fresh.
So where does it go from here? How do we roll this out to more members of the MGPO?
So currently, it's an R&D process. We're vetting out the service, making sure that everything works well. Then we're going into pilot in primary care, and in parallel working with one specialty after another, anticipating that by March, April, we'll start to move into a production mode. And so our physicians are going to be hearing more about rolling this out over the summer and into the fall.
And I would imagine this is something that will be received very well by doctors and by our patients. Maybe not by every doctor or every patient, but certainly by a lot of them.
That's right. And that's important for our colleagues to know, which is that it's not one size fits all. And so for many of our physicians, this will be a good option, but we still have voice recognition, we have in-room scribes, and of course we have optimization of use of Epic, and that's all the different flavors that our doctors will be using.
So David, thank you for the work you've been doing for our patients and our doctors here at the MGPO. I'm incredibly excited to see how virtual scribes works. I'm Tom Lynch, and that's Two Things.